Hi there, Dr. Todd Cameron here, GP and Medical Director at M3 Health. The reason you're seeing this video is that your GP has determined that you may have a suspect case of COVID. And so what that means is that your symptoms could fit within the expected range of symptoms that we could have with a patient with COVID, or you may have undertaken some activities or been around some people that put you at an elevated risk. What does that mean? Well, it means firstly we'll be organising testing in almost all cases for you, and you should also receive a second message which is around testing. That message will tell you the Australian government locations, Victorian government locations for testing that you can undertake, and also the COVID hotline where you could call to just confirm the location and the timing for that testing. So keep your eye out for another message with that detail. The most important information here is to download the document that is associated with this message. That document will cover off on our isolation guidance. What's most important here in a suspected COVID case is that we treat you as if you have COVID until we know better. And so what that means is you are to stay home unless it is completely unavoidable that there is something you must do. And testing, for example, would be one of those circumstances. So stay home, and ideally, if there are things that need to be done, they should be done by people outside of the household, bringing those in for you, whether that's shopping or retrieving things for you. Within the household, we want you to have meticulous hand hygiene. So nothing beats soap and water for 20 seconds. Make sure that you're getting a really good lather and you're covering your hands nicely. You're covering all parts of your hands, backs, fronts. Make sure you work through the thumb as well, and also the fingers at the end. So 20 seconds or more. Ideally washing with a paper towel, drying with a paper towel rather. You can dry with a normal towel, but make sure you're washing those regularly. So just remember, the person with suspected COVID needs to have meticulous coughing and sneezing hygiene, into the crook of the elbow always. Preferably stay to a reduced area within the house. So if that person can stay in one room, that's even better. If you do have a second toilet, a bathroom, then ideally you separate out people that are well from the person that is unwell, just because it reduces the chance of spread within the family unit or your household contacts. So wherever possible, do that. Remember that the person who is unwell should not be cooking for other household members. That's probably a relatively easy way to spread COVID. So that person should not be caring for others in the household. This may be really difficult with young children, of course, but ideally the person who is well is still continuing to care for other household members. Cooking should only be done by the well people, and ideally the person who is unwell, who's the COVID suspect case, gets all of the food and drink that they need brought to them, and maybe paracetamol, of course. And make sure that if you do need to leave the home, or if you do need to have contact with other household members, that you wear a surgical mask. You should be able to get these from a GP clinic or from a pharmacy. You don't need to wear it all the time, but if you are around other people, it is just to prevent the virus from being spread more easily from the person that is unwell to those that are not. And hopefully the test result would be back within 2 to 3 days is the current cycle. But in other countries, this has come down to as little as 4 hours. The shorter it is, obviously, you're in the circumstance of not knowing for a longer period of time. So once we actually know which way you are, whether it's positive or negative, then we'll be determining your next action. Make sure you book regular appointments with your usual GP through this time, just so you can keep them abreast of what's going on and they can actually put the information into the context of what's relevant for your health and your health care. I've been Todd Cameron. Bye.